The highly contagious Delta variant is now the dominant coronavirus strain in the United States. How big a threat is it? Hello, I'm Arnold Naidu, and this is The Heat. The United States has seen an 11% rise in new coronavirus cases reported over the last week. Infections are almost entirely among those who have not been vaccinated against the virus. It comes as the highly infectious Delta variant becomes the dominant COVID-19 strain in the country. Correspondent Ediz Tiyansan has the latest.
Fears of a potential outbreak in California's state capitol building after 9 staff tested positive for the coronavirus last week prompted a return to the mask mandate for all lawmakers and staff. It comes after months of steady declines in California's coronavirus infections that are once again on the rise, largely due to the spread of the highly infectious Delta variant.
From the most recent data that we have, we now think that Delta is the most prevalent variant in the U.S., having overcome Alpha.
The Delta variant is believed to be about 60% more transmissible than the conventional coronavirus strains, and the U.S. Centers for Disease Control and Prevention estimates that it now comprises nearly 52% of cases nationwide.
We are seeing some small clusters and larger outbreaks of COVID-19 in locations such as camps and community events where proper, hard-learned prevention strategies are not enforced and the virus is readily able to thrive.
She says around 93% of COVID-19 cases have occurred in counties with vaccination rates of less than 40%. Vaccines have not completely stopped people from getting infected, but the White House says they have prevented severe illnesses in most cases.
Virtually all COVID-19 hospitalizations and deaths in the United States are now occurring among unvaccinated individuals. And to be clear, there will likely continue to be an increase in cases among unvaccinated Americans and in communities with low vaccination rates, particularly given the spread of the more transmissible Delta variant.
Drug makers Pfizer and BioNTech announced on Thursday they're working on a third booster shot that would provide greater protection against new variants. Hours later, the U.S. Food and Drug Administration and the CDC issued a joint statement saying Americans do not need booster shots just yet, adding it was not up to individual companies to decide. Authorities are confident that vaccines are an effective tool to stop this latest surge in the number of coronavirus cases and hospitalizations. The White House says it will ramp up federal assistance by sending special teams to provide COVID-19 treatments and vaccinations in hotspot states, including Arkansas, Missouri, Nevada, and Illinois. In the meantime, the highly infectious Delta variant continues to spread faster than other strains, leaving unvaccinated residents at a greater risk than ever before. Ediz Tiyansan, CGTN, Los Angeles.
Okay, let's look at these developments in greater detail and get to our panel. Here in Washington, D.C., Kate Tulenko is the CEO of Corvus Health. Yaneer Bar-Yam is the president of the New England Complex Systems Institute. He joins us from Boston. From Jackson Hole, Wyoming, Devra Davis is an epidemiologist. And from the Normandy region in France, Gustavo Ribeiro is a journalist and founder of the Brazilian Report. Thanks to all of you for joining us. And Yaneer Bar-Yam, let's start in Boston. At this stage, about 70% of adults in the United States have received at least one dose of the vaccine, but as we've just heard, there are still concerns. Here is the director of the CDC again.
The Delta variant is spreading rapidly throughout the country. This week, the Delta variant is estimated to be the most prevalent variant in the United States, representing over 50% of sequenced samples across the country, up from 26% from the week ending June 19.
So, Yaneer Bar-Yam, what is your assessment of the risks that the Delta variant now poses to public health?
So there are several things to talk about. First of all, Delta cases are growing rapidly, and there surely is a preponderance of cases among people who are not vaccinated. But even vaccinated people can get cases that can become severe, and there are deaths among people who have double vaccine or who are fully vaccinated. So it is not like the vaccines are providing a completely free pass. And we should remember that even mild cases, from what we know from the past, result in a substantial percentage of long COVID cases, long-term serious consequences, that now the increasing evidence is that there is substantial brain damage. So that's been something that's been discussed for almost a year now. And there are increasingly studies that point to the significant brain damage as a consequence of even mild and even asymptomatic cases.
So, Yaneer, just to clarify the situation, you were saying that there are people who've been vaccinated, who've had both their doses, if they're taking those vaccines that need 2 doses, and those people, after having contracted the virus again, have died. What do we know about this? Are these people with very serious pre-existing conditions? Have you seen a lot of this?
Remember that we do not know at this point in time what gives rise to more severe cases and milder cases. It could be having to do with exposure. It could be having to do with underlying genetic differences or medical conditions. But there has been no real identified pattern across them, and that's probably the wrong way to think about it. In the meantime, there is a significant chance that people will who get infected will have severe cases, and some of them will die. And just to push this a little bit further, there is at least a report of a choir that met a couple of times, and 20 individuals who are part of that choir had been fully vaccinated, but 15 out of the 20 were infected. I don't know if that was the Delta variant, but it is likely given the fact that Delta variant is the growing variant in the country at this time.
Kate Tulenko, this makes my next question to you even more relevant right now from what we've just heard. Pfizer, the pharmaceutical company, as well as BioNTech, says they've seen a drop in the effectiveness from its vaccine, and they've announced that booster shot that was announced just a couple of days ago, which they say will offer even greater protection against the Delta variant. But the Biden administration says not so fast, it's not necessary. So what's going on here?
So I think that the CDC still wants more data on the Delta variant and the effectiveness of the vaccine before they commit to another round of vaccines. I think that's really what it is. It's good in general that Pfizer is thinking ahead and thinking about the need for boosters, because the virus does seem to be changing relatively rapidly and looking more like a flu, where you have to have an annual booster rather than a one and done type of shot. But I think, in looking at the economics of this, I think this shows that the Biden administration is worried about the economics of it, of requiring another dose, another vaccine, because we already have the expenses of the lockdowns, people losing their jobs, business disruption, children out of school, the medical expenses of those who are very ill or who are out sick, and then, as was mentioned, the long COVID costs of people who end up having a chronic disease after COVID. Then on top of it, the cost of the original vaccine, then perhaps a booster shot. So we're really talking about trillions of dollars in damage here from the COVID virus.
But Kate, is there time right now? Because Pfizer is saying that the effectiveness of the original vaccine starts dropping from about 6 months to a year.
Mm-hmm. Yes, that is the case, and they're still following the original people who were vaccinated in the first trials, and they will publish more of this data and give the FDA access to that data. So we will know more in the following months, and I do predict that most of us will need booster shots, but I think the CDC and FDA are being right by wanting more data before they make a decision on this.
Right. Devra Davis, there's been an analysis that was done by Georgetown University which shows that there are low vaccination rates among people, especially in the southern states of the United States. The study says this poses a risk because those areas could be breeding grounds for even more different kinds of variants. What do you make of the study and of the conclusions that it reaches?
I think it's very important study, and we should pay attention to it a great deal. One of the other issues that has not been addressed is the fact that it does appear that those who have had COVID, who then get vaccinated subsequently, if they've had long haul symptoms, vaccination appears to be reversing those symptoms from the long haul. And that is something else that's being investigated. With respect to the southern states, we have a huge disparity racially. And around the country, 9 times more Black and brown people will die from COVID than whites. And even when they're vaccinated, the rate of death is still higher. And this has to do with underlying disparities in access to care, increased morbidities such as diabetes and obesity. So we really need to look at this as a huge public health problem. The vaccine really has laid bare a lot of the inequities in the healthcare system that we face today. And we can't address all of them through vaccination. Everyone understands that. But the problem in the southern states has been rendered even worse by the disparities between the governor, for example, of Texas, and the mayors of the large cities, Austin and Houston, which have been trying to push certain protocols. And they've made progress in some areas, but in others, such as Mississippi, Louisiana, there's huge resistance that has been fueled from the top down, and that's highly problematic.
Devra, what do you make of this one conclusion that the study reached, which is that if there are large numbers of people who have not been vaccinated, then that could be a breeding ground for other variants?
That is exactly correct, that if there's a large number of people without vaccination, then they exchange the new virus as it mutates. And the virus mutates because it takes the host, people who are not vaccinated, grows in them and becomes even more successful. That's what viruses do. That's what their job is. And without vaccination, people become literally like petri dishes to breed even more virulent forms of the virus. And we now have the Delta Plus variant, which appears to have taken root in Brazil. I'm sure you'll be talking about that. And it obviously is an example where in Brazil there's been a total lack of encouragement for vaccination, and they're paying a heavy price as a consequence.
Right, we're going to be talking about Brazil right now. Let's go to Gustavo Ribeiro. Gustavo, you're normally based in Brazil, but you're talking to us from France. Brazil is fast approaching the United States in the number of deaths from COVID. What we know is that more than 100 million doses of the vaccine have been administered, but only 14% of the population has been fully inoculated. What can you tell us about the risks that the Delta variant is posing in Brazil?
Well, the Delta variant has been identified in a few regions in Brazil, but the cases are still in very low numbers. Right now, 97% of cases in Brazil are of the Gamma variant, which was first spotted in the Amazon region. I talked with a few epidemiologists in Brazil, and they say that the Delta variant is not the major risk right now because of the predominance of the Gamma variant. What they warn is the fact that Brazil's vaccination rollout has met a lot of hiccups along the way. Right now, 5 state capitals have stopped rollouts because of a lack of jabs. And if vaccination does not progress in a fast enough way, we could see a new wave of infections. Right now in Brazil, unlike other countries, we don't lack people willing to vaccinate. A poll that was released yesterday shows that 88% of the population either has already taken a vaccine or wants to. The problem is not enough vaccines are available in Brazil right now. Due to the Delta variant, a few states and cities are changing their vaccine policies and shortening the interval between the 2 jabs. And that's not, that poses another risk that some epidemiologists in Brazil say that we need the first jab spread around as many people as possible, as fast as possible, while others say, okay, let's use the jabs we do have to get 2 doses of Pfizer and AstraZeneca to as many people in order to these people get them inoculated against the Delta variant.
Now, Gustavo, as you say, availability is a problem in Brazil. What's the outlook for that? Do they see the country getting more doses of vaccine in the coming months?
Yes, we have shipments from Johnson & Johnson coming. Pfizer rollouts are starting to pick up more and more. And a few states in the Northeast have just signed a tender to import Russia's Sputnik vaccine. So we do wait for vaccination rollouts to remain at a fast pace. But the problem is we still are not able to produce from A to Z vaccines within Brazil. So that makes us exposed to availability in other countries who would ship the vaccines to Brazil.
Kate Tulenko, I want to look a little bit beyond the United States shores right now to other parts of the world. Let's look at England. England has decided to end all COVID restrictions from July 19th. Here is the Prime Minister Boris Johnson.
We are trying to move from a system of very elaborate government rules to one in which we rely on people to exercise personal responsibility to follow guidance, mindful that, as I say, this pandemic is far from over.
So, Kate, here we have the Prime Minister saying, look, the pandemic is far from over. We expect people to basically take responsibility for themselves. What do you make of this? Is this the appropriate time to lift all those restrictions?
Well, the UK is trying a delicate balancing act. Hospitalizations are actually going down in the UK, but cases are going up because of the Delta variant. And also the UK has pursued a different vaccine strategy than the US. The UK is not vaccinating children 18 and younger. They're only vaccinating adults, mainly focusing on the older adults. So it's a different strategy that will, they hope save them money and also make more vaccines available for other countries that don't have access to the vaccine. So I think you're seeing this effort to reopen business and, have that responsibility of keeping people safe move from the government to the individual.
Yaneer, Bar-Yam, this weekend we'll also see the final of the Euro 2020 football championships. That'll take place at London's Wembley Stadium. Now, there are expected to be 60,000 fans sitting in that stadium when those two teams come onto the field. There has been a study in Britain which already shows that there's been an uptick in infections from people actually watching these games in bars, in restaurants, in pubs and things like that. I mean, could these turn out to be super spreader events?
Absolutely. Let me correct a couple of things. First of all, it was mentioned that after vaccination, some people who have long COVID have reduction in symptoms. It's only a certain fraction, about half, maybe 2/3 of people have some reduction. And there's surely no indication that things like brain effects that result in changes in the volume of parts of the brain, reduction in the volume of those parts, has been corrected by those vaccinations. The second thing is that hospitalizations are going up in the UK. They're going up rapidly now with the increase in the number of cases. And indeed, the existence of potential super spreader events promises to make that worse. What's actually happened in the last couple of days is that many scientists from the UK and around the world have signed a letter that's been published in the Lancet and on the John Snow Memorandum website that is very severely disagreeing with the government policy, saying that this is totally outside of a scientific guidance. And it's really important to see the motivation for what they say, because what the UK is doing and making it personal responsibility really makes it impossible for people to protect themselves, because a person even wearing a mask going into a space cannot protect themselves from other people who are not wearing masks who are infected.
Kate Tulenko, very briefly, I mean, it seems here that the British government is defying science, defying what the scientists are telling them.
Well, I think they're trying to balance that economics and scientific, or economics and health decision, with the concern that, more people potentially would die from suicide or depression, or that, in other countries you have more people potentially dying from starvation. So I think that's the balance they're trying to make, as well as the political call that they're trying to make as well.
Gustavo, there's also a big sports event on Saturday in South America. We'll see the final of the Copa America. That's between the two biggest rivals in South American soccer, Brazil playing Argentina. There have been no crowds at the matches so far, but the organizers say they will allow up to 8,000 people to attend the final on Saturday evening at Rio de Janeiro's Maracana Stadium. What are people in Brazil saying about this? I mean, given the numbers, is that a smart decision?
Well, no. Actually, hosting the Copa America was not a smart decision to begin with. The Copa America was supposed to be held in Argentina and Colombia, and Brazil decided to host it on the 25th hour against all advice from experts. And the thing is, in Brazil, social isolation is not observed right now, and most people are going about their business as usual. And the thing is, the government, states are starting to open up and lift all restrictions. And at this point in Brazil, because of the economic setbacks that restrictions have imposed to Brazilians, and the fact that we have an economy that depends on the in-person, we have a country that depends on the in-person economy, restrictions have been something of the past for months now. So as much as I think that what is happening with the Copa America is not smart at all, the fact is that social isolation is not a thing in Brazil right now, and it has not been for months.
Okay, Kate, back in the United States, the CDC is pushing for in-person schooling in the new school year, which starts in just over a month. Children under 12 right now are not eligible for the vaccination. Is that too soon to restart in-person schooling?
You know, I think that it's appropriate. I mean, hopefully we won't have worse things happening with Delta, but right now it is appropriate to get children back, especially many children in major metropolitan areas. School can be the safest place for them. And the CDC is still recommending guidelines like people who aren't vaccinated should wear masks indoors, maintain social isolation of 3 feet, other measures, such as good hand hygiene and reducing other high-risk activities. And these proposals have the support of both major teachers' unions. And so I think you will see the vast majority of school systems opening in person in August or September of this year. But I also think that probably by Thanksgiving, children 6 and up can be vaccinated.
Devra Davis, I'm glad you're back with us. I want to ask you about the other big sports event that's going to be taking place very soon. In fact, it will begin in about 2 weeks, and that's the Tokyo Olympics. Now, after initially saying that they will allow a limited number of spectators at the Olympics, the organizers in Tokyo, in Japan, have said that they're not going to allow any spectators into the stadiums right now. But should these games really be going ahead? Because there are going to be thousands of athletes from all over the world at the games.
Back to the athletes. Japan, as you know, has been very slow to roll out vaccination. They insisted that they would not accept the data from other countries, and they had to have their own trials to see whether or not the vaccine worked.
We appear to have lost Devra there. We'll try and get back to her. Let me go to Yaneer Bar-Yam for the moment. Yaneer, Dr. Mike Ryan of the World Health Organization says that the worst of the pandemic in terms of deaths and hospitalizations has passed in many countries. But he also had this warning. He warned that the virus could evolve into something that vaccines will not be, where vaccines will not be effective. They will no longer protect us. What are your thoughts on that?
So as the variants arise, it's very possible for a variant to arise that completely evades the vaccine and to put us back into a situation where not only we have a virus that's spreading rapidly in the population, but that it is spreading much more rapidly and is more severe. I would like to point out that the narrative that there is a trade-off between health and economics has not been validated. In fact, it's the opposite. The countries that have achieved elimination, including China and Australia and New Zealand and say the eastern part of Canada, have all done much better economically than the countries that are trying to live with the virus. And the trade-off in the UK is simply a manifestation of that failure to seek elimination. And right now is actually the best time in many places to go for elimination, because the US has much fewer cases than it had in the past. It's much easier with a vaccine to achieve elimination. And for example, much of Eastern Europe, including Poland, Czechia, and so on, and even much of India, after their tremendous outbreak with the Delta variant, is now down at under 1 case per million. Even Delhi is very close to being at 1 case per million, which is the threshold at which contact tracing can stop an outbreak, even if it happens.
But Yaneer, isn't it the case that when we look at that balance that countries are trying to strike between the economy in the countries as well as combating the pandemic, that, I mean, we have countries like Australia, New Zealand, as you pointed out, parts of Canada as well, which took this pandemic very seriously right from the beginning, but that wasn't the case, for instance, here in the United States, or for that matter, the United Kingdom. So in many instances, they're having to play catch up right now.
Well, that's true, but the point is that with the vaccine, we have a powerful tool that enables us to reduce dramatically transmission. And so it's much easier to achieve elimination than it was at the beginning. And in fact, that's the reason why the US has cases down, even though there are not very many restrictions around the country. But if we open up fully, as we're doing with the Delta variant, as has been shown in Israel, where the vaccination rates are high, and there is a tremendous outbreak right now starting from a single imported case, that we are vulnerable to going back to a situation of dramatically increasing cases. So basically right now we have a high leverage opportunity to go for elimination. But the fact that we're not doing that is putting us back in this yo-yo lockdowns that are the real cause of the economic hardship, rather than the elimination process, which would enable us to get out of it.
Gustavo, we have seen that in many countries this pandemic has been heavily politicized. Brazil is one of those countries where it has been politicized. In fact, the Brazilian president, Jair Bolsonaro, has been harshly criticized for his handling of the pandemic. And there's now also a congressional investigation in Brazil into possible bribes paid for vaccines. One of the polls recently showed that 51% of Brazilians do not approve of the job that President Bolsonaro is doing. I mean, what can you tell us about the situation in the country politically? There's elections coming up in Brazil in just about a year's time.
Yes, exactly. The government is facing its worst situation in terms of popularity. As things stand, Bolsonaro faces an uphill battle because we have former President Luiz Inácio Lula da Silva, the center-left icon that ruled Brazil for 80 years in the early 2000s, who is back to the electoral game and leads by 20 points all polls. The corruption scandals regarding vaccines have further dented Bolsonaro's image, but the thing is, and I mentioned this the last time I was in the heat, I think it's still too early to count Bolsonaro out. Brazilian voters are motivated by their immediate needs because of the social vulnerability we have here. So if the economy improves, Bolsonaro's re-election chances also improve.
Right, and as you pointed out, there is still a year to go to the election. But that's where we have to leave it. Thanks to all of you for being with us. That is it for this edition of The Heat. I'm Anand Naidu in Washington, D.C. Thanks for watching.